hospice house is a surprise to most patients and families who come here. It is not a place to die, it's a place to live until you die.
It was just such a loving and caring environment. It was beautiful.
Knowing that he could even come here was a big relief. He knew it was going to be okay at the end.
What a beautiful thing a life ending can be.
When the community hospice house opened, it was established to meet the needs of residents who were near end of life.
The promise to the community was that we would care for people regardless of their financial circumstances or whether or not they had any insurance. We actually visited a number of hospice houses up and down the East Coast, and we also engaged an architect who specializes in healthcare facilities. And in that way, we were able to translate our dreams into the reality that this house is today.
Each patient has their own room, their own bathroom. Family has an area in there. So it's almost like having a little private apartment here. Very quiet, very peaceful.
Privacy as you walk by the rooms. You don't see the patient. You can stay with the patient in the room.
It really is a home, and I think that the atmosphere allows people to feel comfortable and tend to their loved ones.
The outdoors is landscaped by area garden clubs, and families can come out and just spend some time out in the air. The goal is to give people a place where there are few interruptions for them to do the work they need to do.
The Great Room is a gathering place for families and children to come together, to do things that they would normally do in their own homes, such as watching TV, talking to one another, reading with staff, perhaps sitting in front of the fireplace, listening to the grand piano, taking in the outside, the views. It just has a multitude of purposes.
The environment here is really lovely. People are really able to get comfortable and find serenity here very easily. If patients are too weak to get out of their beds and they want to go outside, we can open up the French doors and wheel them right out onto the patio.
The facility allows people to come back into their role as a husband, a wife, a daughter, a son, and not have to be the caregiver who's doing the physical, emotional, and spiritual care.
Rather than worrying about what do I have to do? Do I have to give them, more pain? Is it time for this? Is it time for that? They can allow us to do the nursing.
We're an interdisciplinary team. We have social workers, chaplains, nursing assistants, doctors, nurses, volunteers, and a cook.
The staff here are just excellent at symptom management, and that's the piece that's offered here that cannot be achieved in another setting.
Their commitment is to help people find a peaceful end to their journey and a dignified manner.
My husband was under hospice care at home. Gene suffered from ALS and was becoming agitated at night, and I was on the phone a lot in the middle of the night with the nurse, and she finally suggested that we should come here. And this is a facility that we knew absolutely nothing about. And as soon as we walked through the door, I just knew this was a magic place. Every moment that he was here was comfortable. It's just an amazing, warm, magic place to be at a very stressful time for most people.
It was our son Keith that was here. Keith, as a high school boy, was very active, very athletic, did a lot of things like gymnastics, ultimate frisbee, things like that. He was getting ready to head off to college and was diagnosed with brain cancer. The difference between the sterile environment and the cold environment of the hospital to walking into here was just amazing. It was beautiful.
Just to be able to so peacefully say goodbye, a moment that's so sad can still be beautiful in a way.
The hospice house is not just about caring for the patient, it's caring for the family. And so the family is in trauma as it is when you know the death is imminent. They just surround them with love and compassion, and they take the time to answer questions and to help them, to help the patient kind of continue on the journey. And that support doesn't end when that patient dies, because they're there for you for a whole year afterwards. They offer bereavement support group meetings every month, which I still participate in. It's not like if you were in a hospital and you passed away and you walk away and that's it. When you pass away in hospice care, you're a part of their family.
The commitment was, we build this house, we'll take anybody who comes here who needs the facilities, and they've done that 100%.
Many people, even people with really good insurance, wouldn't be able to stay here without community support.
You walk in the door and it doesn't feel like any kind of healthcare facility. It's like a home.
It was like coming to heaven. That's what I said when I walked in the door here.
To be here at the Community Hospice House was a wonderful experience to go through when you have to say goodbye to somebody. If Keith were here, I know he would say the same thing.
I mean, they're just angels. And the care that was given to the family was just unbelievable.
And something that they will cherish for the rest of their lives.
If you can't be at home, this is the place to be.
My son, Keith, was born at home, and being here at the Community Hospice House, it feels like he died at home.